Hello everyone, it's Tuesday and you're watching Within the Frame. I'm Kim Bo-kyung. South Korea is suffering from a chronic doctor shortage, especially in essential departments and regional areas outside the capital. Such a shortage is expected to further escalate as the country is in the process of becoming a super-aged society with a low birth rate. Thus, the Yoon administration is seeking to increase the overall medical school quota starting in 2025, which has been capped at 3,058 since 2006. However, doctors say just increasing their numbers will not help unless pay for work in unpopular but essential medical fields is improved, and advantages are given to those practicing medicine in rural areas. How serious is the shortage issue and how should the discussion develop? For this, we invited Dr. Alice Tan, an internist at MizMedi Women's Hospital. Welcome, Dr. Tan.
Thank you for having me.
Thank you for being with us. And we also have Professor Son Ho-jun from Seoul National University. Good to see you again, Professor Son.
Good to be back.
Good evening. All right, first question to our Dr. Tan. Let's first casually talk about how popular doctor is as a job in South Korea. Soon, the Suneung, or Korea's College Scholastic Ability Test, will be held. And among the 500,000 students, more than 30% are so-called ensusaeng, which means they have already taken this test. And one of the reasons for the retake is because many students prefer medical school. How do you see such a trend?
You know, I think everyone can agree that we all benefit when our medical workforce is composed of people who are the brightest of the bright, but also dedicated, empathetic, able to work well in a team. You know, they're collaborative people, they're creative. That's the kind of workforce that we want working in the field of medicine. We do not necessarily need to fill the medical workforce with people who are the best test takers. And unfortunately, this Suneung system favors this latter category of people who are merely, say, good test takers are the ones who are sort of shunted into the medical field. I think it's an unfortunate way of using potentially wonderful resources in terms of time, energy, and manpower for students to be spending one extra year, sometimes several years, just studying for this one test. I would understand if there's a handful of students who are retaking the test because of extenuating circumstances, but this system doesn't quite seem to make sense, and perhaps we need to rethink the medical school admissions process so that we are selecting students based on a more comprehensive set of qualities, not just scoring high on the Suneung test.
Right, well, I cannot agree more. But Professor Son, many are pointing out to stability and high income as main reasons for choosing the job as a doctor. But some say this is because the absolute number of doctors is low compared to other countries. And according to OECD data, the number of clinical doctors for every 1,000 people was 2.6 as of 2021, which falls short of the OECD average. But how are doctors viewing this data?
Yeah, I have to say my opinions are not a reflection of all of the doctors in the community. So, but just to say, I think most people, our community agrees that there is a shortage of doctors. Mm-hmm. But the other thing that we need to consider is the indicator that we're using to compare with other countries is just an average, and we shouldn't be falling in the traps of the average. There's a lot of focus on doctors being centralized in Seoul, and the other indicators that we have for health outcomes, such as life expectancy, is one of the highest amongst the OECD countries. And we have to also consider the fact that our country has the most highest healthcare utilization rates. So there's a lot of issue at play, not just the number of doctors per 1,000 population. But when you combine all of these things, I think our system is performing really well compared to other countries, despite the number of doctors. But then the number of people utilizing health services being highest means that doctors are being demanded a lot. So there's a lot of workload issues for physicians as well as anyone in the healthcare system. So we need to be really considerate of these dichotomies and discrepancies of these indicators. So in short, I think there is a shortage, but we also have to factor all other considerations so that we pick the right people and then really think about how much we need to adjust to address the shortage issue.
All right, I see. Well, I totally understand that there could be unique characteristics that South Korea only has. But Dr. Tan, I think there is a consensus that the number of doctors in essential fields is too low. Could you tell us why some medical fields are more popular than others?
Well, one reason is because doctors are choosing to go into potentially more lucrative medical fields with a lower exposure to medical liability. For example, and then they're also thinking about prospects of jobs after training. For example, if a doctor is considering, say, the field of pediatrics, now South Korea famously has the lowest fertility rate of all OECD countries. People simply are not having babies as much as they did, say, a decade ago or 50 years ago. So your prospects of being employed after training, say, in pediatrics or obstetrics, is lower, and that's a reality that some doctors are considering. Also, the reimbursement scheme may make certain fields less attractive, and so a doctor may prefer, instead of say if they trained in neurosurgery, instead of performing brain surgery, which is a high-risk procedure which can only be performed in specialized medical centers in metropolitan regions, they may decide to do something such as pain medicine, which is lower risk, and also you don't have to worry about reimbursement through national health insurance. Patients are often paying out of pocket for these services. So there are a lot of push and pull factors in terms of what is driving doctors towards certain fields, specialties within the medical profession. And of course, then this is causing, in some areas, deficiency of doctors who are trained in the essential fields in particularly rural areas. And so I don't know that it's necessarily a quantity issue in terms of an absolute shortage of doctors. It seems more like a distributive issue in terms of where our doctors are located. You know, is it in the metropolitan area versus the rural areas, the provinces, and then also which fields are the doctors concentrated in? Are they in more lucrative, out-of-pocket fields that they can charge for procedures that are not covered by national health insurance, or are they stuck within a reimbursement scheme that doesn't reward doctors for, say, more sophisticated high-risk procedures?
Right, I see. So it seems there are some of the aspects that are making students to choose certain departments. I see. Well, Professor Son, another major issue is the exodus of doctors to Seoul. According to the data, less than 2 doctors per 1,000 people are staying in provincial areas. How serious is this shortage of doctors?
Yeah, I think Dr. Tan pointed out this issue in her response as well. It's pretty serious, but also we have to think about the laws of supply and demand. The 1/4 of the population lives in metropolitan Seoul and vicinity regions in Gyeonggi province, and there naturally is more demand for health services there. Also, there's a lot more infrastructure and training opportunities in these areas compared to rural and other regions of Korea. So there's an exodus of many physicians and medical professionals wanting to live and train in Seoul. It's the very similar trend of any other professional fields in Korea that's being very centralized to Seoul, and I think this is just not just the problem of our medical field. It's somewhat following the structure of all of our economy, political, and administrative systems that we have here in Korea. So it's hard to say that this is something that we could solve with some sort of different rules and regulations and programs, but I think it's just it's definitely creating a huge problem for quality of service and service coverage in rural areas, and we really definitely have to think about more comprehensive approach to address this problem.
All right, I see your point. Well, considering all of this, and given that the demand for medical services will only continue to soar due to South Korea's aging society, the government showed its willingness to increase the quota for medical school admissions. And the question is the size of the increase, though our Dr. Tan already pointed out that this is not just a matter of quantity. But Dr. Tan, how is the discussion of this increase developing now?
Right. I was just at a meeting of my medical school where I graduated this last weekend, and this topic did come up. And I know that at my medical school, they are already planning for increasing the size of the incoming class. I think it's in a few years by 50 students. And so they are working with the government to try to increase the numbers of incoming medical students. But as I said, just because we have a higher number of doctors, I don't think that necessarily means that the problems will be solved, because the problem is a distributive problem. So again, if we have, instead of 100 doctors, 150 doctors, but they all decide that they are going to live and work in Seoul, and they all decide that they are not going to go into essential services, we're basically right back where we started. And so we do need to look at this problem comprehensively. We need to figure out why. Why is there an exodus from the rural regions and the provinces, and start with more of a root cause analysis in terms of what's going on with the demographics as well. But then also we can look abroad and see, we're not the first country to face this kind of problem. There are countries that started healthcare workforce teams, where there's a specific agency that addresses the paucity of doctors in rural areas. And so they have teams in place where it's either doctors in training or doctors who have just finished their specialty training. They may be required to do 3 or 4 years of service in a rural area before they are licensed to practice independently. I think one difference, though, is that in some countries, such as the UK or Australia, sometimes doctors are considered part of the public or government employee workforce. And so it's a little bit easier in terms of human resource management from a government perspective. Here in Korea, even though we have national health insurance, the vast majority of doctors are in private practice. And so in this situation, you have to look in terms of, how can we incentivize doctors to work in the provincial areas? And in terms of accessibility, what sort of technologies can we use to provide access to people in rural areas to high quality medical care? Certain solutions can include telemedicine, for example, wearable monitoring devices, in-home healthcare that people can access. There is a whole range of medical solutions that we need to be creative and consider when we're tackling this very, very complex issue. It's not just increasing the numbers alone. I don't think that's going to be the fix-all for this very complicated problem.
Right, I cannot agree more. And as our Dr. Tennis keeps saying, increasing the whole enrollment quota may not be enough to tackle this issue. And so there must be some additional measures taken place. Well, first of all, Professor Yoon, Doctors say the government needs to boost compensation for those working in essential medical fields. What is this about?
Yeah, Dr. Ten also highlighted this earlier. The medical reimbursement schemes for fee-for-service, certain fees that are covered for basic practices or follow-up visits, these are really low compared to any other OECD countries. So, and doctors are being incentivized to look at other services like dermatologies or things that are not covered through national health insurance, so that they have a bit more of a convoluted practice to generate income. What I want to just say is that amongst the OECD countries, doctors in Korea actually are well compensated, and even even after adjusting for purchasing power. Actually, when you adjust for purchasing power, Korea ranks one of the highest. So I don't think it's just about doctors being well compensated. I think it's just a lot of systems issue, also an issue of a workload. And as I mentioned earlier, I think the workload issue is not just about number of doctors, but also number of clinical visits that people are making on average. Korea has highest number of care-seeking visits per year by large. It's we're one of the top 2 countries. So when patients are seeking a lot of care, it just naturally creates a lot of workload and burden for doctors in general. Let me also mention that medical professions and healthcare system and health for all is not just about doctors. Doctors are one part of the equation, and they are important. There are nursing workforce and other workforces that supports the doctors that are really essential and important. And there's significant shortages for them, and they're underpaid, less appreciated. And I think all of these supporting casting systems needs to be also looked at. So it's the focusing the discussion on doctors is important, but we have to look at this more holistically.
All right, I see. So it seems that it's quite necessary to go over systems and workload issues along with reimbursement scheme as well. Now, Dr. Tan, another suggestion to increase the number of those working in essential services is coming up with a law to prevent doctors from being embroiled in medical suits. Is this among the major issues doctors in essential fields are currently facing?
Certainly, doctors are concerned about decreasing their exposure to medical liability, but primarily the way that doctors do this is through adhering to practice guidelines, ethical guidelines, safety guidelines. Tort law reform can place caps on punitive damages in medical liability cases. This is something that can be considered, and in the United States, states that enacted tort law reform related to medical liability, they did see a decrease in the number of frivolous lawsuits brought against doctors. And so this is a consideration in terms of making the practice of medicine less focused on defensive medicine and instead concentrating more on providing high quality, safe care without the worry of the risk of medical liability.
All right, I see. Well, we are keep discussing many other possible options that we can think of to tackle this issue. And now, Professor Son, to make sure doctors stay in rural regions. Experts say it is necessary to select local students from those very regions to fill medical school quotas. What is your view on this?
Yeah, I think it's one of the nice ideas. How that gets put into practice and in reality, what will happen. Forcing people to stay because you're born there is not the most ideal way of doing it. There will be people who wanting to move out. There will be people who wanted to stay. Giving scholarships and admitting students from the local regions and mandating them to stay for X number of years in the region would definitely solve the problem temporarily. It's certainly not going to solve the problem permanently. I think there's a lot of other things at play, as I mentioned earlier, care seeking, the centralization of many of the things in Korea are to Seoul location, training programs, all of these things are really, really at play. So partly will solve the problem temporarily again, but certainly we have to come up with a more holistic approach to think about how we would address the training problems when there's less service demands, less people coming, and less specialization practice that's being available in rural regions. Again, it's you got to train the doctors, and it takes a long time to produce a really well-trained doctors, right, in internal medicine and any other specialties. And it's not just about forcing them to stay in rural regions.
Right. We do need to come up with a holistic approach, like our Professor Sohn said, considering the capital concentration this country is, going through right now. Well, Dr. Tan, experts also emphasize the need to significantly increase government support for regional and regional national hospitals. Do you also see the need for such a measure?
I do. I do agree with this because I think there's a need to strengthen the capacities of regional healthcare centers. There are some rural areas, island regions, some places where people simply cannot access potentially life-saving medical care because they're missing the so-called golden time, say after a stroke or after a heart attack, because of lack of healthcare facilities that have the proper capacity and staff to provide that essential life-saving care. And this is really a tragedy, I think. So I think there needs to be an emphasis on improving the capacities of regional healthcare centers. Another example would be to provide cancer care in these regional healthcare centers. So a patient could perhaps receive their initial care in the metropolitan region, but then if they need subsequent, say, infusions of chemotherapy, they don't necessarily have to get on the train and travel for 2-3 hours just to get infusions of chemotherapy. If there is a regional cancer center of excellence near their home, they can continue their cancer care there. The important thing, though, is to have a well-functioning network, healthcare network, so that patients feel connected and that they understand that their care is well coordinated and seamless. So even if they go to their regional healthcare center, they feel confident that they are receiving high quality care, that they don't need to travel to the metropolitan areas, that really is not a necessity for them, that they can receive the care that they need in a much more accessible location.
Right, I see. So more support is needed for better healthcare network. Thank you, Dr. Tan. Well, this, I believe, would be our last question. So I'd like to ask our Professor Sohn. We have been seeing clashes between the government and doctors over this very issue. How should it be dealt with, in your opinion?
Yeah, it's a tough question. I think each side has their own opinions and also difficulties and priorities. I think there needs to be a lot of discussions and talks and planning. This problem is not going to be solved in months' time or even a couple of years. It needs to be, as we mentioned earlier through the discussion, there needs to be a bit of holistic approach. We need to be thoughtful of other healthcare professionals around us. There needs to be a step-by-step approach. I think what's important is that this should not be a political agenda. It's always been a political agenda, and when there's new political system and parties come into play, it's always their priority, but then there's a different agenda on plate. And there's a lot of, also within the doctors, there's a lot of disparities and disagreements. So I think we just need to find a way to talk to each other, share different perspectives, and make sure that we are able to accommodate and understand different perspectives. I think we've been failing in that regard. So just yelling and telling that there's a problem, there's a shortage, there's a workload issues. I think it's not just the doctors that there's this problem. We have to be mindful for others and others around. And what we have to focus is that it's not just the doctors, it's actually people around us that needs care, that needs to be focused. We always forget that in this discussion, where we are trying to do this for people in our country who needs help, and for the better health of our citizens. So when we forget that, it becomes a dispute.
Right.
So we should never forget that important issue.
Right, I cannot agree more that this cannot be political agenda, and hopefully discussions can lead to a positive outcome. Well, thank you, Dr. Tan and Professor Sohn, for your insights and time. We really appreciate it.
Thank you.
Thank you. That's all for Within the Frame tonight. We'll be back tomorrow with more in-depth stories. Thank you for watching, and goodbye.